Hi, my name is Avery and I'm a peer educator at the Forestville Teen Clinic. Today I'm here to talk to you about female-specific anatomy. Now there's a couple things I need to go over before we actually start the video, and first off I'm going to be using they/them pronouns to be describing people with female-specific anatomy, since not all people who have female-specific anatomy identify as a woman. Next of all, for whatever reason you're watching this, it's perfectly valid. There's many reasons to know about female-specific anatomy, and we're here to give you a couple. That includes knowing your own anatomy if you are female-bodied. Being able to know and recognize when there are changes in your anatomy is really, really good because those can have health concerns that you need to talk to your doctor about. Next is knowing what feels good. If you know what feels good on your body, you might be able to better convey that to your partner. If you can better convey that to your partner can better pleasure you, which is generally better sex. Next is making sure that you are able to identify with people who have different anatomy than you. Say you're not female-bodied and you aren't attracted to people with female bodies. You can still have friends who have female bodies, and knowing what they go through is really important to be able to empathize with them. Now that we've gotten those out of the way, let's go ahead and start with the external anatomy. Now this picture is drawn of someone laying on their back, so up here would be their stomach, and down here is their back. And this general area is called the vulva. And up here at the top of the vulva is the mons pubis. This is where hair tends to grow during puberty and all that fun stuff. And over here and here are the labia majora. They help keep the vulva all nice and snug when you're just walking around doing your daily business, and keeps bad stuff from getting in and keeps good stuff from getting out. And just inside the labia are the labia minora. These come in lots of shapes and configurations and colors, and it's perfectly normal for them to change at some point in your life. Up here at the top, where the labia start, is the clitoris. And the clitoris is kind of like an iceberg. Most of it is underneath the surface, but up here you can see where it breaches the surface. And right around here would be where the clitoral glands would be. And right here is where the shaft of the clitoris would be, and it's covered by some skin called the prepuce. And the prepuce moves over the clitoris so that it can be stimulated without overstimulating the extremely sensitive nerve. Now, in between the labia and underneath the clitoris, it's called the vestibule. And the vestibule is where the urethra, where you pee from, and vaginal openings are. Now we'll go over in more detail about the vagina in the internal anatomy section of the video, but really quickly I'd like to point out that when a vagina is formed, there'll be a membrane around the opening called the hymen. And there's a myth that when a person who has female genitalia engages in vaginal intercourse for the first time, her hymen has to be broken. But that's not true. For the most part, a hymen can be stretched to allow whatever needs to come in, and even in some cases, the hymen doesn't need to be stretched at all. Now, underneath here, between the vaginal opening and the anus, is called the perineum. And, of course, there's the anus, which is where solid waste leaves the body. Now that we understand the external anatomy, we can go on to see the internal anatomy. We're going to follow the root of the egg, which starts here in the ovaries. Now the ovaries are where the eggs, or ovum, are stored, and these eggs mature and are released into the fallopian tubes. And there's two ways of an egg can leave the fallopian tube. Fertilized, which is with a sperm, or unfertilized, without a sperm. If an egg is fertilized, meaning that a sperm has come up and gone into the egg, and will go into the uterus and attach itself to the uterine lining, which is called the endometrium. This will become bigger and bigger and eventually become a fetus and a baby, and then it will be born by the widening of the cervix through the os, which is the hole in the cervix, and come out the vagina or be pulled out of the womb. If an egg is not fertilized, the egg will come out and be shed with the endometrium in the form of a period. So, now that we know all of that, let's talk about what each of these things is. So, the ovary is where the eggs are stored. Fallopian tubes connect the ovaries to the uterus and serve as a place for the egg to be fertilized. The uterus itself is kind of like a fist muscle. It's really, really closed up and is about the same size as a fist. So my uterus is about this big. Next is the endometrium, which is the lining of the uterus. And the endometrium becomes thicker or thinner depending on where a person is in their cycle. Over here we have the cervix, which is kind of like a donut-shaped muscle, and the hole in the cervix is called the os. And the os lets sperm in, lets blood out during the period, but other than that, not much gets in and not much gets out. And we have the vagina, which is basically a pathway of muscles and is really, really cool. It expands during arousal and pushes all of this up, and that's the internal anatomy. Have a question about your anatomy? Come into the Forceful Teen Clinic Monday through Thursday. On Mondays, we're open from 12 to 5 p.m. On Tuesdays and Wednesdays, we're open from 2:30 to 5 p.m. And on Thursdays, our late day is when we're open from 4:30 to 7:30. Thank you for watching, and enjoy your Sex Quest video.